Hello, welcome to my presentation, Public Health Financial Management Final Project. My name is Clement Chihuahua, and I'm the Chief Financial Officer for University of New Mexico Health Systems. My presentation overview includes introduction, merger heuristic criteria, organization snapshots, financial reports, and creditworthiness report. Most of the rural healthcare organizations in the United States are facing a huge financial crisis. And as much as 80 of the rural healthcare organizations have closed so far. And it is estimated that over 670 more are at risk of financial meltdown. And I was tasked to find a possible solution for two healthcare failing organizations in my area. And Penobscot Valley Hospital and Asheville Medical Center. There are two rural hospitals that are also in the same category as the rest of other rural healthcare facilities nationwide. And we have to note here that rural healthcare facilities provide healthcare to about 60 million people across the country. And so it is imperative that we do find lasting solutions as soon as possible to avert the severe consequences as a result of this financial crisis. Now, most of these problems could be attributed to a number of factors, but most importantly, we have to understand that the size and limited assets and financial reserves these small organizations have some of the major contributing factors to their financial instability. And also due to the fact that these rural hospitals rely heavily on government payments from Medicare payment systems, and which most recently have been reduced or cut in some other areas, leading to these rural hospitals looking for other forms of funding to supplement the operations. So I developed a criteria for this possible measure of the two organizations. And these were actually based on the mission, vision, and values, Medicare and Medicaid, and other forms of reimbursements, expenditures, and overall financial status. So some of the criteria include organizational goals, financial stability, size and services, management structure, community engagement, performance ratings, transparency and accountability, employee engagement, geographical position, and marketing. So the mission goals for both Penobscot Valley Hospital and Asheville Medical Center, they emphasize on the provision of quality community health care. And the financial reports for the 3 years indicated heavy financial losses, dwindling revenue, and bad debts. In terms of size and services provided, Penobscot Valley Hospital provides more services and is a much bigger organization as compared to Asheville Medical Center. Both organizations are based in a rural area, and their management structure comprises of CEO, CFOs, and senior directors, and a board of directors. Community engagement. Both these organizations, they are quite heavily involved in their communities. They work together with the communities in a number of projects. For Penobscot Valley Hospital, that includes cancer support groups, providing scholarships to students to pursue health care related degrees, They also provide local employment opportunities, and they conduct blood drives. For Ashton Medical Center, in addition to running an outreach clinic, they also provide, they have a number of wellness health centers across the area to provide additional health services in rehabilitation. And I also assessed performance ratings as a criteria, and that data was collected from patient reviews. And for both organizations, it indicates that they had favorable ratings from the patients. Accountability and transparency, mainly in the areas of finances and performance. I analyzed those through the auditing, provision of auditing reports and budgeting. So both organizations, they are strictly adherent to a policy in which they provide financial information disclosure to the public, and they file their taxes and disclose the finances to the government as well. Employee engagement is one of the critical areas for this merger analysis, as it ensures that there's a consistent provision of high standards of care, and thereby the employees must also present themselves and work towards the goal and mission of the organization. So some of the factors assessed are appearance, attitude, and respect. So for both organizations, they emphasize on these factors for their employees so that their goals can be met by the end of each and every year. Both Ashton Medical Center and Penobscot Coast Valley are rural community healthcare organizations, and the majority of the patients they serve are elderly population and poor, and they are heavily dependent on Medicaid and Medicare programs. Organizational snapshots, which we looked at the mission, the vision, the status of these organizations. So both organizations are non-profit organizations. The the Penobscot Coast Valley Hospital was established in 1937, and their mission is to be the first choice in healthcare and to provide quality healthcare services with compassion and safety. And the Penobscot Coast Valley Hospital was established in 1973, but prior to that there were two small privately owned hospitals. And due to the demand and growth of the population and also the demand for an ER led to an establishment of Penobscot Coast Valley Hospital. And in 1988 it went major rehabilitation and remodeling to expand a number of facilities within the compound, and in 2000 the hospital was recognized as a critical care access hospital. Ashton Medical Center's mission is to serve the community in the areas of preventative, curative, supportive, and educational health care that meets physical, emotional, and spiritual needs of the community. Their philosophy is a commitment to excellence of service in person-centered environment. Ashton Medical Center was established in 1972, and it comprises a level 4 trauma center and a nursing home. Ashton Medical Center too had made it their mission and vision to serve the community and to engage with them in the wide range of areas which include community health assessment. Financial reports for the two organizations, which was analyzed from the IRS tax return documents and audit reports, mainly focusing on the organization's funding sources, assets, liabilities, capital investment, salaries and wages, and their operating net margin. And also stocks were analyzed. For the capital expenditure, for Penobscot Valley Hospital, it showed that they spent about 4 times more money on property, buildings and equipment for the 3-year period that we analyzed, which is different to Ashley Medical Center anyways. For the operating margin and net margin, the very obvious assessment was the fact that these two organizations, both of them, they incurred negative operating profit margin, which basically means that they are operating under financial losses, and they are either borrowing or trying to streamline services in order to meet the demand for the operations of the hospitals. Their long-term debts remained constant for the 3-year period, and there was poor bad debt repayment. Total revenue remained constant, but total revenue matched expenses at the end of each fiscal year, with no profit made and either losses also made at the same time. The creditworthiness report, we conducted the creditworthiness report based on the Fitch ratings criteria and the Moody's Investor Service rating methodology, which looks at the Fitch ratings methodology looks at the assessment of a hospital's financial profile and the operational effectiveness. Now, I did my calculations based on the Moody's rating analysis in key 5 areas, which were operating performance, balance sheet and capital plan, governance and management, debt structure and the legal covenant. Now, for market position, which the Moody's rating recommend 45% and above as a positive creditworthiness, and the market position looks at total revenue growth, and Medicare and Medicaid with a total of 45%. For Penobscot Valley Hospital and Ashley Medical Center, here it clearly shows from the calculations that these hospitals did not even come close to the 45% market position rating as recommended by Moody's. So it's very obvious that these two organizations are in deep financial troubles, and we need to find an immediate solution while we're still looking for a lasting solution, enable for them to continue providing healthcare services to these rural populations. And my recommendations for post-merger is that for Penobscot Valley Hospital, salaries and wages were a much bigger expense, and then we need to find ways in which we can trim salaries and wages to cut the cost. And then the financial analysis of Penobscot Valley Hospital, and for Ashley Medical Center, financial analysis indicated the organization was just breaking even in each of the 3 years. But then I suggest increasing fundraising activities which would generate substantial funds to avoid closure. Thank you. These are my references.